If you're a man over 60, I want you to pause for a minute and listen closely to this. Because there's something many older men do every single day, sometimes 10 times a day, without realizing that this habit is silently blocking the flow inside their body, making their feet cold, their hands numb, their morning energy drop, and even weakening their masculine strength year after year. It's not fast food. It's not alcohol. It's not lack of sleep. It's a very silent habit. So silent that 8 out of 10 men I meet never suspect it's the main cause of their poor circulation. And in today's video, I'm going to tell you directly exactly what that habit is, why it is shutting down your blood flow, and more importantly, the simplest way to reopen that flow, help warm your feet, clear your mind, and restore your natural masculine strength. But before I go deeper, I want to know one small thing from you. How old are you? And which state in the U.S. are you watching from? Leave a quick comment. Because I want to understand this amazing community of men following this channel. I'm Dr. Emily Carter, a urologist with over 14 years of hands-on experience working with men over 55, 60, and even 80 years old. And during that time, I've seen thousands of cases that are strangely similar. Men feeling colder in their hands and feet, getting lightheaded when standing up, experiencing weaker urine flow, and noticing their male response isn't as strong as it used to be. What's surprising is that most of them think, I guess that's just age. But the truth is very different. When I run deeper tests and ask detailed questions about their daily habits, I find a repeating pattern, a few harmless-looking habits that tighten their blood vessels, thicken their blood, and slow down their circulation year after year, until they barely recognize their own body anymore. And that is why I made this video, to help you and thousands of other men understand that poor circulation is not destiny, and that by fixing just a few small habits, your body can recover much faster than you think. And if you're watching this video, you've probably felt some of these signs in your own body: cold feet at night, slight hand numbness in the morning, a bit of dizziness when standing up, or a male response that's not as quick as when you were 40 or 45. I want you to know this. Those changes are not your fault, and they are not signs that your body is running out of time. Circulation weakening with age is common, but in most cases, it's not caused by age. It's caused by habits men repeat unconsciously for years. When I talk to patients, they often say, I thought all older guys were like this. But that's not true. Your body is capable of recovering far more than you think. You just need to understand what's happening inside it. And before I continue, I want to ask you a very simple question, but one that helps me understand our community much better. How old are you? And which state in the U.S. are you watching from? Just leave one short comment. It helps me create more accurate, more helpful content for the exact stage of health you're in. Now, before we talk about the habit that's clogging the flow inside your body, I want you to understand this very clearly. Circulation in men over 60 does not weaken because of age. Circulation weakens because blood vessels change. After age 55-60, a man's body goes through a series of silent shifts. First, the blood vessel walls become less elastic, like a rubber band that's been used for too long. It doesn't stretch as easily anymore. When the vessel walls stiffen, your blood has to move through a tube that's no longer flexible, and that reduces blood flow to your hands, your feet, and especially your pelvic area. Second, nitric oxide drops significantly. According to the Cleveland Clinic, men over 60 produce nearly 50% less nitric oxide compared to when they were 30. Nitric oxide is the switch that opens your blood vessels. When it decreases, the vessels struggle to dilate, and circulation slows. You'll feel cold feet, afternoon fatigue, and difficulty maintaining masculine strength. Third, common issues at this age: high blood pressure, high cholesterol, fluctuating blood sugar, make the blood thicker, slower to move, and sometimes allow tiny plaques to build up inside the artery walls over time. And there's one more thing many men don't realize. When testosterone drops, it doesn't just affect intimacy. It also makes the blood vessels constrict more easily, which further restricts the flow to the reproductive organs. But the most important thing I want you to understand is this. Every single one of these changes can improve if you know exactly which habit is making things worse and change it in time. And that's exactly what we're going to talk about next. The first mistake, and also the one I see in almost every man over 60, is sitting for too long during the day. I know this sounds simple, but its impact on your circulation is far stronger than you might think. When you sit for 60–90 minutes straight, blood begins to pool in your legs, not because your heart is weak, but because your leg muscles, which act as a secondary pump to push blood back to the heart, have been resting for too long. Harvard Health has shown that sitting for long periods can reduce blood flow in the legs by up to 40% after just 1 to 2 hours. And that triggers a chain reaction: cold feet, heavy, numb calves, stiff knees when standing up, and most importantly, reduced blood flow to the pelvic area. This is why so many men tell me, "I'm just sitting at work, watching TV, or reading. I don't understand why my masculine strength gets weaker each year." Sitting too long doesn't just affect your legs, it compresses the blood vessels in the pelvic region, reducing blood flow to the reproductive organs over time, and men don't notice it until the effects become obvious. The solution is incredibly simple. Stand up and walk for 2–3 minutes every 45–60 minutes. Just this small change has helped many of my patients reduce numb legs, sleep better, and improve their masculine strength without taking a single pill. The second mistake is something almost every man I meet is guilty of: drinking coffee the moment they open their eyes. I know coffee is a morning ritual for many, but for men over 60, drinking coffee too early is a direct hit to circulation, and very few realize why. When you first wake up, your blood vessels are naturally constricted after many hours of lying still. This is a normal physiological response, but when coffee, a strong vasoconstrictor, enters your system, right when your vessels are already tight, it makes things worse. Blood is harder to move, your hands and feet get colder, your heart has to pump harder, and blood flow to the pelvic area drops for the first 1–2 hours of the morning. Not only that, caffeine reduces nitric oxide production, the molecule that helps your vessels open and keeps circulation smooth. The result? You feel sluggish, cold in your extremities, tired by noon, and your masculine strength in the morning, which should naturally be at its peak, becomes weaker. But here's the good news. You don't need to give up coffee. You just need to change the timing. The correct solution: drink warm water plus a little vitamin C right after waking, then have your coffee 30 minutes later. This simple timing shift opens your blood vessels in the morning, boosts blood flow to your heart, brain, legs, and even your sexual organs, without taking away your favorite habit. And now, the third mistake, one that causes circulation problems in so many men over 60, yet almost nobody knows it: vitamin K2 deficiency. I call it the silent culprit, because you can't feel it immediately, but it silently blocks your blood vessels for years. According to the NIH, 97% of Americans are deficient in vitamin K2, and older men are the most deficient group. So why is K2 so important for your circulation? Because K2 is the calcium transporter. Without K2, calcium won't go into your bones. It will drift into the wrong places, including your artery walls. When calcium sticks to your blood vessels year after year, the vessels become stiff, thick, and narrow. This makes blood harder to move, forces your heart to pump stronger, and reduces blood flow to your legs, hands, and especially your pelvic area. That's why so many men say to me, "I eat well, I drink enough water, I exercise. So why are my feet still cold and my male response still slow?" Because when you're low in K2, your blood vessels are like pipes lined with limescale. They can't open, they can't stretch, and, naturally, circulation will never be smooth. The good news is that K2 can reverse this process. When you take the right form of K2, especially MK7, K2 sweeps calcium out of the arteries and moves it back into your bones, where it actually belongs. The result? Softer blood vessels, improved circulation, warmer feet, more stable morning energy, and a stronger masculine foundation. If you've ever heard someone say, poor circulation is just age, that's not true. In many cases, it's a K2 deficiency, a deficiency almost no doctor talks about. And if this part is helping you understand your body better, you can hit like or share so more men can learn this important information. Now that you understand why low K2 makes your blood vessels stiff, I want to share something very important with you. K2 only unleashes its full power when paired with D3 and omega-3. These three nutrients work together in a very special way, like three gears locking perfectly to help your blood flow become smoother week after week. First is vitamin D3. D3 is like a doorway that allows calcium to enter your body. Without D3, calcium won't be absorbed properly, and you'll remain calcium deficient no matter how much you take. But here's the real issue. D3 brings calcium into the body, but K2 decides where that calcium goes. Without K2, calcium enters, but sticks to the artery walls, like bringing goods into a warehouse and placing them on the wrong shelves. That's why D3 and K2 must go together. D3 brings calcium in. K2 sends calcium to the right place into your bones, not your arteries. And then comes omega-3, the final piece. Omega-3 reduces inflammation inside the vessels, naturally lightens the blood, and keeps the vessel walls flexible. It's like applying a thin layer of oil inside the pipes, helping the flow move smoothly without putting extra pressure on the heart. When these three nutrients work together, your blood vessels soften, calcium stops sticking in the wrong places, blood flows warmer and more evenly, and circulation to your legs, brain, and pelvic area improves noticeably. Many of my patients only needed to correct these three nutrients to significantly reduce cold feet, tingling hands, lightheadedness when standing, and especially to improve masculine function naturally. I'm telling you this so you understand that your body is not declining. It's simply missing the right signals and the right raw materials. Before I tell you the 3 simple habits you can start today, I want to share a short story with you about a patient I will never forget. His name was Harold, 72 years old, living in Colorado. When Harold first came to see me, he said something I hear from so many older men. "Doctor, poor circulation is probably just age. I don't think it can get better." At that time, his feet were ice cold every evening, his hands tingled every morning, and the thing that saddened him most was that his masculine strength was almost completely gone. He thought he had to accept it. But when I looked closely, everything was clear. Harold was severely deficient in K2, low in omega-3, and had almost no D3 in his blood, a trio his body desperately needed to reopen the flow. I told him, "Harold, your body has never abandoned you. It's just waiting for the right conditions to work again." He nodded, though I could see the skepticism in his eyes. Still, he decided to try. We started with gentle supplementation, D3 in the morning, K2 MK7 at lunchtime, omega-3 inches the evening. No strong medications, no procedures. 3 weeks later, he called me, his voice full of surprise. "Dr. Carter, last night was the first night in almost 3 years that my feet weren't cold when I went to bed." 6 weeks later, he returned for a follow-up. He laughed and said, "And I feel stronger in the way a man should." His morning energy came back, his hand numbness reduced, and the circulation in his legs improved significantly. What impressed me most wasn't the result, but how he changed his belief about aging. He said, "I thought I had no hope left. Turns out my body just needed the right help." Harold's story isn't an exception. It's proof of an important truth. Circulation can reopen at any age, if you give your body the right signals. And from Harold's experience, I want to share with you the 3 small habits I taught him. Simple things that made a huge difference. And that's exactly what we'll go into right now. The 3 habits you can start today. Now, I want to give you a few very clear steps, things you can start today to reopen your circulation more quickly, gently, and safely. No heavy exercise, no expensive equipment, just 3 extremely simple habits. First, drink a warm glass of water right after waking up. After 7-8 hours of sleep, your blood naturally thickens. A warm glass of water slightly thins it. gently wakes up your blood vessels and helps your heart pump more efficiently. Many men tell me that just doing this made their feet warmer and their mind clearer in the morning. Second, take a 10-minute walk after each meal. Walking right after eating doesn't just help digestion. It activates your calf muscles, the body's second heart. Just 10 minutes can boost blood flow by 25–30%, especially to the legs and pelvic area. This is one of the most natural ways to improve masculine strength after 60. Third, stretch your calves twice a day. The more flexible your calf muscles are, the easier it is for blood to return from your legs to your heart. Just stand near a wall, bend your front leg slightly, keep the back leg straight, and hold for 20–30 seconds. Doing this 2–3 times in the morning and before bed significantly reduces tightness, numbness, and cold feet. These small habits, when done consistently, can permanently change the way your body feels. Less cold feet, less dizziness when standing, and a natural return of masculine strength just as it should be. And before we move into the final part of today's video, I want you to listen very carefully to this. Your circulation is not permanently weakened. Your body has not abandoned you. And what you're feeling, cold feet, tingling hands, fading energy, slower male response, does not mean you're getting old in a negative way. A man's body after 60 still has a very strong ability to recover. Your blood vessels can soften again, your blood flow can become strong again, and your masculine strength can return naturally, as long as you give your body the right signals and the right habits. I've seen many men at 65, 70, even 82, improve their circulation with just small adjustments: drinking warm water in the morning, walking after meals, adding K2 plus D3, and reducing the habits that constrict their blood vessels. After a few weeks, they tell me, "My feet feel warm again. I don't wake up with numb hands anymore. My mornings feel stronger, and I feel more confident." Those changes aren't luck. They're the body responding to the right signals. And I believe your body can do the same, because the most important factor isn't age. It's how you treat the flow inside your body starting today. Now, since we've gone through the 3 biggest mistakes that restrict circulation in men after 60, I want you to remember something very clearly. Poor circulation is not the destiny of aging. It's simply your body reacting to habits you've been repeating for many years without realizing it. But just like that, a few small adjustments, standing up more often, delaying your morning coffee, and adding the right K2, D3, and omega-3 can change your circulation week by week. And more importantly, those changes can bring warmth back to your feet, light morning energy, deeper sleep, and a natural return of masculine strength. Before we end today, I want to hear directly from you. Of the 3 mistakes I shared, which one do you think affects you the most? Just leave a short comment. Not because of the algorithm, but because your answer may help another man, someone going through exactly what you're experiencing, realize that he's not alone in this journey. Thank you for staying until the end of today's video. I truly appreciate every minute you've spent learning more about your body and about the things that can help you feel stronger, more confident, and more energized after age 60. If these insights brought you clarity or a renewed sense of hope, you can hit like or subscribe to the Senior Men Health Secrets channel. Not so I get more views, but so you don't miss the important content related to circulation, men's physiology, morning energy, and the daily habits that help men over 60 live healthier, more active lives. And before we finish, I want to remind you of something important. The information in this video is based on current medical knowledge, but it does not replace diagnosis, treatment, or individualized medical advice. Every body is its own journey, so if you have underlying conditions, take medication, or experience persistent symptoms, please speak directly with your healthcare provider to get the guidance that fits your personal situation. What I've shared today is not medication, not a cure, but natural strategies that help your body function at its best, just as they have for hundreds of older men I've worked with. Thank you once again for being here. I'll see you in the next video.